So, first lab value is potassium. This is the most important one. I say most important in terms of blood pressure medication, but all of them are important. So, once you start taking these medications and your doctor starts monitoring them, your doctor wants to know if the potassium is too high or too low, because either one of those can affect your heart rhythm, right? Whether or not your heart is beating, okay? Beating too fast, beating too slow, both of those have negative outcomes. The next lab value is sodium, abbreviated Na. Potassium is abbreviated K. So if you see me use K on the slide, you know what that is. Low sodium, low salt. Sodium is your salt. Low sodium can cause fatigue, confusion, and dizziness. So we see this sometimes in the elderly population. People say, oh, my mom, she was dizzy and she fell. She's been having these falling spells. It could be tied to one of the medications that your mother is taking. This is why it's important to know what their labs are. And if you are your family's patient advocate, I recommend that you gain access to their chart and that you have a form filled out to where you can have, the doctors can talk to you about what's going on with the family member. So if you don't fill out this POA, if they don't have this on documented, if you don't fill out a health surrogate form, if you don't have all of that, doctors may not give you everything that you need to know. And you may not see these results because I have to tell you, a doctor who is seeing hundreds of patients in a day is glancing over your information. They aren't 100% locked in. Some are, very few are, but some are. But the majority of them, they're hitting the highlights, right? And they're not looking at the trends on your patient, your mother, your father, right? So you as a patient advocate must do this.